The longest running monarch in Britain's history, Elizabeth Alexandra Mary, or more commonly known as Queen Elizabeth II, died yesterday in Scotland at Balmoral Castle, where she had been for the past few months. She had reigned for 70 years, becoming queen at the tender young age of 26, and had been the first monarch to celebrate the Jubilee, a celebration of 70 years on the throne. Now, there will be many obituaries and videos out there, but I want to focus on and try to answer the question, how did she actually die? What was she doing up in Scotland? Why was she not taken to hospital? Hi, welcome back to the channel. My name is Dr. Aziz, a physician in the UK. I've been in England my whole life from birth, so the Queen has been there for as long as I can remember and from well before. Now, at the outset, it has to be said, until now, no official cause of death has been released by the royal family. In the UK, there is no obligation for a cause of death or autopsy report to be made public, so we may never be informed of the official cause of death. What I will be doing in this video is mentioning what I feel, in my medical opinion, was the cause of the Queen's death, the health issues leading up to her demise, and whether in fact anything could have been done to save her. The Queen Mother lived up to the age of 101, passing away in 2002. Her husband lived until 99, passing away last year, and now the Queen herself at 96. I have also previously worked as a geriatric doctor, or care of the elderly as it is called now, so I will give my input from that perspective. But first, let's go through some of the health issues that we know the Queen was suffering from. Officially, and to the public knowledge, she was not diagnosed with any long-term conditions at any point in her life. She lived to 96 and remained in relatively good health throughout her long life, 73 years of which she spent alongside her husband, Prince Philip. Some minor health incidents marked the beginning of her 70s, including a bout of flu in 93 and a horse riding accident in 94, which left her with a broken wrist. She briefly used a walking stick in 2004 after knee surgery and spent a night in hospital in 2013 with gastroenteritis. As she got older, she resisted handing over official duties to other family members, believing they could only be carried out by the monarch. She regularly appeared at public events and met foreign and domestic political leaders, making it clear she intended to carry on the job until the end of her life. She also retained control over much of the royal family's business. She made sure Charles' wife Camilla would receive the title of Queen Consort, stripped her son Prince Andrew of his royal duties over child sexual abuse allegations, and navigated the controversy following a public falling out with the Duke and Duchess of Sussex, Harry and Meghan. It was only recently after Prince Philip's death in April 2021 that her own health issues began to affect her ability to fulfill her official duties. From late 2021, the Queen began to suffer what Buckingham Palace called episodic mobility issues, and was seen using a walking stick in October during a visit to Westminster Abbey. She nevertheless that month rejected the Oldie of the Year award, her assistant private secretary telling the Oldie magazine, "Her Majesty believes you are as old as you feel. As such, the Queen does not believe she meets the relevant criteria to be able to accept, and hopes you will find a more worthy recipient." But as her health problems worsened, she spent a night in hospital for the first time since 2013 for some preliminary investigations, although we don't know exactly what. She missed the COP26 summit in November 2021 after she was told by doctors to only undertake light duties. She missed several other events in November, including the Remembrance Sunday service in London, after spraining her back. The spread of the Omicron strain of COVID-19 also meant the Queen kept a low profile for much of the rest of 2021, cancelling a pre-Christmas lunch with extended family and spending Christmas at Windsor Castle instead of her usual choice of Sandringham House in Norfolk. In February 2022, she attended an in-person celebration of her Platinum Jubilee, marking 70 years on the throne. Later that month, she told members of royal household she felt stiff when moving. Again, something certainly not unexpected for someone in the mid-90s. Even with all the precautions, the Queen could not dodge COVID forever. She returned a positive test in February 2022, earlier on this year, but only came down with mild symptoms, and Buckingham Palace continued to reassure the public she was working in isolation. The Queen had apparently all 3 COVID vaccines. The Queen performed only light duties following her bout with COVID and missed public events such as Commonwealth Day services and the opening of the UK Parliament, but she did attend the opening of a new underground tube line in London, the Elizabeth Line, named in her honour. The final week. In the last week before she died, the Queen cancelled various scheduled virtual appointments. A new Prime Minister, Liz Truss, was appointed, but both the previous Prime Minister, Boris Johnson, and Liz Truss travelled up to Balmoral Castle in Scotland, the first time a new Prime Minister of England was appointed in Scotland. This is possibly the last official picture taken of the Queen on the same day, just 2 days before she died. On September 8th, it was reported that doctors had become concerned for the Queen's health and family members were summoned to Balmoral Castle, where she passed away a few few hours later. So what do I think was the official cause of death, or at least major contributing factors? Firstly, as obvious as it sounds, old age and frailty. This is something that we often put on death certificates, certainly on people aged 80 and over. And remember, the Queen was 96. As we age, and certainly past the age of 40, our organs begin to slowly die and lose functionality. In many brain scans we do of people in their 60s, for example, these will report nil significant, just age-related small vessel damage or disease. Similarly, the heart, lungs and kidneys all lose functionality year after 40, and overall we age, become more frail, and our body's reserves to fight off illness or disease become significantly depleted. Secondly, was she suffering from long COVID? As mentioned, she had COVID in February 2022. Long COVID is generally defined as still experiencing symptoms 3 months after the infection. Sometimes patients' lungs or heart are left with residual damage after the infection. That being said, the Queen was still carrying out duties even just 2 days before she died, as can be seen in the pictures already shown, and certainly was not bedbound. So something must have happened to cause the acute deterioration and death in the final 24 to 48 hours. In most cases, this is actually a chest infection progressing to pneumonia if not promptly treated. This raises an interesting separate point. The Queen at all times has not just had one designated physician, but a whole team of doctors looking out for her. There is no doubt they received privileged treatment, as evidenced by Prince Philip at the age of 99 last year, in the weeks leading up to his death, having multiple treatments including a cardiac procedure in hospital. As a doctor who's worked in cardiology on the NHS previously, I can tell you they will not do this for any other 99-year-old. We also see in America former presidents such as Jimmy Carter receiving active treatment well into their 90s and still plodding along. So why was the Queen not taken to hospital? Two possible reasons. One is that she may have had a terminal diagnosis that has never been disclosed, and it would have been futile taking her to the hospital. Again, this is speculation, but a possibility. She looked relatively well just 2 days before she died. Second is a term we call inanition, where a patient often gives up the will to live. I think having lost her husband of 73 years the previous year would have no doubt had a huge impact on the Queen. So many times we see this: when a long-term partner dies, the other one soon dies. Ultimately, it was the Queen's decision. She did not want to be taken to hospital and treated. In my medical estimation, there was a gradual decline since losing her husband last year, mentally and physically, and despite her natural strength and fortitude, she decided this was the end. Most likely there was an infection, chest, urinary or otherwise, that both the Queen and her family decided not to fight aggressively, but rather keep her comfortable at her favourite home, Balmoral Castle. Again, as mentioned, this is just speculation in my opinion. Nothing official has been released, and they may never do so. Rather, natural causes and died peacefully is likely what will be mentioned as the official cause in the coming days and weeks. Either way, we wish all the best to the royal family and thank the Queen for all the good that she did. Anyway, what are your thoughts and what are your memories of the Queen? Do post below. If you found this video interesting, be sure to like and subscribe. Have a watch of these other famous deaths and autopsies that I've covered on the channel. Until next time, stay safe.